Hi, I'm Diane, and I am a clinical exercise physiologist with True Fitness. So, this is the 11th of our 12 mini workshops for our Sláintecare project. And the topic for this week is cardiovascular diseases. So, some of the main ones that are prominent in the group, but then importantly, also cardiovascular health and the role of exercise in the primary and secondary prevention of cardiac conditions. So just an important piece of background information. John and I in True Fitness have been commissioned by Elite Sports Partnership to design and deliver a 12-week strength and fitness intervention for adults in Laois aged 50 to 80 years. And this research study, fantastically, has been funded by the Sláintecare Integration Fund under Grant Agreement number 21. And if you'd like to hear more about the study design and what we're doing, I will present it at the end of this presentation. Just for now, to say that this mini workshop is part of a number of workshops that were created for the participants as part of this research. Okay, so the cardiovascular system, of course, is concerned with the heart, but also all of the blood vessels that go all around the body and supply all of our muscles and tissues with oxygen and nutrients. Okay, so in terms of these blood vessels, so the arteries that basically supply oxygen and nutrients to every part of the body, they are very susceptible to damage, and particularly the lining of the arteries that supply the heart with blood and oxygen and nutrients are also very susceptible to damage. And if this happens, a series of reactions basically happens that causes plaque formation within the lining itself. And when this happens, the artery can become narrowed. And the more it develops, the more narrowed the artery becomes. So you can have a partial blockage. And in this case, you have insufficient blood and oxygen going to a particular area. So the blood is trying to go from A to B, but because of the blockage, you have a seriously reduced volume of blood and oxygen and nutrients going from A to B. And if this happened, for example, in one of the coronary arteries, this can cause chest pain, and the pain is because there's not enough oxygen getting to the tissue, the far side of the blockage. And if this continues to occur, atherosclerosis basically, if it continues to occur, the artery can become fully blocked, and in that case, you can suffer something like a heart attack. Um, but if this happens in the brain, it could be a stroke. And if it happens in the periphery, so for example, in an artery in the calf, so the back of the lower leg, it's called peripheral artery disease. So it can happen anywhere. And if this is the case, then what happens is you can often end up with high blood pressure because trying to get blood and oxygen and nutrients from A to B through a very narrow space requires a lot of blood pressure. And so this type of plaque formation can actually increase your blood pressure, trying to squeeze that blood through a small space. And if this happens for a long time, it's called shear stress, and it can actually cause further damage to the lining of the arteries, and it can exacerbate the problem. So blood pressure is something that we like to do everything we can to treat. Untreated, and in severe cases, it can lead to things like heart failure. But rather than really focusing on the diseases, of which there are many, this is just the tip of the iceberg. I really want to focus on, well, what are the potential causes and what can we do about it so that we can keep our heart and our cardiovascular system as healthy as possible, and also what is the role of exercise. So there are modifiable and non-modifiable risk factors, and the non-modifiable ones are known risk factors, but they're things that we can't do much about. So for example, age. And in previous lectures, we've gone through the physiology of aging. So aging brings deteriorations in different systems, skeletal system, muscle, and so on. And it does to the cardiovascular system as well. It's a contributing factor. It doesn't mean just because we're aging, we're going to get cardiovascular disease. It's just to acknowledge that it has some contribution. Gender as well. So women tend to be more protected against cardiovascular disease up until the menopause because of estrogen and other factors. But after that point, the protection is decreased. So just to be mindful of that. And family history. So if you have an immediate relative or has had suffered some type of cardiac event, your risk is higher. It doesn't mean that, again, this is inevitable for you. It just means you have a higher risk, and you really need to pay attention to the modifiable risk factors and do your best in that case. And so the modifiable risk factors that are known to cause this damage to the lining of the arteries and in turn plaque formation, one of the biggest drivers is smoking. Okay, now all of these factors that I'm just about to mention have their own mechanisms for causing this. And because this is only supposed to be a 10 to 15 minute workshop, I'm just going to list them, but there are evidence-based mechanisms as to why they cause these issues. So smoking is a big driver. Hyperlipidemia is a big driver. So basically, where you have high amounts of total cholesterol, LDL cholesterol, and triglycerides, and low amounts of the good cholesterol, which is your HDL. And a lot of people talk about high cholesterol, and they're talking about one figure, which is total cholesterol. But you should know that you do have a good form of cholesterol, and you actually want that to be high because it's cardiovascular protective. So high blood pressure is a driver of this issue as well. Physical inactivity, and without going into that too much, so like physical activity, when you train, your heart rate, your blood pressure, your breathing, everything basically helps you to move from a resting state to an exercising state. And if you challenge your cardiovascular system appropriately in that way over time with good planned phased training, it teaches your blood vessels how to expand and contract as they should. It strengthens your heart. It improves blood flow to areas. It improves oxygen extraction from your blood. It does so many different things that help promote a healthy cardiovascular system. But conversely, if you're not doing that, you don't get those adaptations. And in fact, if we look at the arteries of people who are chronically inactive, they're much more rigid and stiffened than those who are active. And they don't really know how to respond well to that type of stress. So you can get difficulties in that sense. But physical inactivity is a major risk factor for cardiovascular diseases. Obesity, type 2 diabetes, overconsumption of alcohol, and stress. And stress is an interesting one, and I'm not sure if it's really on our participants' radar in terms of how it impacts the cardiovascular system, but it has a major impact. So if you're chronically stressed psychologically, that stress raises your blood pressure and your heart rate, your breathing rate, and it taxes your endocrine system, and it does all of the things that exercise does, but not in the right way. So if you're chronically stressed, it puts a lot of pressure on the cardiovascular system, and over time it can contribute to this whole problem of atherosclerosis or plaque formation. So of course prevention is best, and the best way of preventing it is to look at all of the modifiable risk factors and do your best with them. So for example, do you need to stop smoking? Do you need to get more active? Do you need to pay attention to your cholesterol levels? Do you need to reduce your weight? Is alcohol consumption a problem? Is chronic stress a problem? So maybe there are things that you can address there. And secondary prevention is very, very effective. So for anyone who has cardiovascular issues, or maybe even has had a cardiovascular event like a heart attack, the news here is that lifestyle change is really, really, really effective. There's decades of evidence to show this. And in fact, what we would see, particularly in our phase 4 classes, is for people who had never trained, or maybe they were smoking and maybe they weren't paying attention to their diet and all of these things, sometimes when they've had a cardiovascular event and they come and they train and they start really looking after themselves and getting fit and watching their nutrition and losing the weight and stopping smoking, they're often healthier than they were before, ever before. So there's really, really good news. And I understand that people can be very afraid after having a cardiovascular event. But the difference that this type of lifestyle intervention makes for the people in our phase 4 groups and everywhere is absolutely fantastic. And the good news is that if you start addressing the modifiable risk factors, and of course you have medical management in this case, it's very, very effective in terms of preventing further events, but also improving your cardiovascular health. So in this case of, we'll say the condition we're talking about is plaque formation, because you have blood trying to go from A to B through a very small space, the amount of blood that your heart can get through that area per beat is less. So the heart will respond by increasing the number of times it beats in a minute. And it will also respond by increasing the force of contraction. And with that, you get higher heart rate and blood pressure at rest during every activity of daily living and during exercise. And the overall consequence is that there is an overall increase in the stress on the heart. Whereas with training, there are numerous benefits to training in terms of cardiovascular health. But again, I'm just conscious for time on this workshop with what we've been asked to do. But one of the positive adaptations to training, particularly aerobic exercise, is that the amount of HDL or good cholesterol you have increases. And its function is to basically keep your cardiovascular system healthy through a number of actions. So the more of that you have, and the training also helps reduce the total cholesterol, the LDL cholesterol, and the triglycerides. And that combined can reduce your plaque formation or your atherosclerosis. Another positive adaptation to training is there are these little tiny vessels that supply your muscles with blood and oxygen and nutrients, and they're called capillaries. And with training, you can improve the recruitment of these capillaries, so of the ones you have, but you can also develop collaterals, which is basically more of them. And also the functioning of the blood vessels, so in terms of how they expand and contract as in an appropriate way. And all of these combine to improve blood flow to an affected area. So if you have reduced blood flow to a section of the heart, or we'll say if it's a section of the brain or the leg or wherever it is, these adaptations can improve blood flow and they can reduce things like chest pain and leg pain and so on. So another really, really positive adaptation to particularly aerobic exercise. And finally, just another key adaptation would be those who are aerobically trained can increase the amount of oxygen they extract from blood, whether it's during at rest or during an exercise. And aerobic training increases the myoglobin content, which is the little protein that carries the oxygen. So you get much more oxygen delivery to where it needs to go. And you have these little these little cells in your muscles, they're called mitochondria, and they're responsible for producing energy for anything that we do every day. And the number of them that you have, the size of them, and the activity of the enzymes within them, all of that increases. And that increases energy production, and it increases metabolism, how you use fuels, and so on. And all of this contributes to improved oxygen delivery and improved production of energy, and all of these things reduce chest pain. So you can't really, you can get some of these adaptations from drugs, of course, but you also get them from training, and they're really, really positive in terms of improving cardiovascular health. So of course, the more training you do, the fitter you get. So that increases your cardiovascular fitness. And we know that's an independent predictor of health, but in the context of cardiovascular disease, it's very important because overall it actually decreases the stress on your heart all day, every day. So with aerobic training, the amount of blood that you can pump out of your heart per beat increases for many reasons. And because of that, because you can inject more blood per beat, your heart rate can actually reduce because it doesn't need to beat as hard because you're getting great ejection of blood per beat. And so your heart rate and your blood pressure decrease at rest, during activities of daily living, and during exercise. And all of these things reduce total stress on the heart every minute of every day. And of course, aerobic training will reduce body fat, which can massively help with cardiovascular disease as well. And the ultimate output of all of these few adaptations that we've discussed is to decrease the overall stress on the heart, which is absolutely fantastic adaptation, particularly for someone who has a cardiovascular issue. So the exercise recommendations for cardiovascular health are actually the same as that for the general population, and they're the same as we have discussed in previous workshops. So in terms of aerobic exercise, this is something that's absolutely essential for anyone who has cardiovascular disease, or on the opposite side, for anyone who just wants to keep their cardiovascular health as good as possible. And the aerobic exercise like walking, cycling, swimming, and so on should be done daily. And in previous workshops, we would have gone through all of these 4 types of training in detail. So you can look back through our series of mini lectures if you're interested in that. So aerobic exercise needs to be done daily. and it's moderate intensity exercise as well. So there's no need for high intensity exercise in this case. Resistance training is also really, really important, and that should be done 2 to 3 days per week as per the guidelines, but I have underlined 3 because the more you do, the more benefits you get from it. 3 days a week is very, very good to get these adaptations that we've just talked about, particularly in terms of increasing the size and number of mitochondria, oxygen extraction, and so on. So the balance work has really no impact on your cardiovascular health, but it's recommended anyway because in terms of falls prevention as we age, and that should be done 2 to 3 days per week. And your flexibility work, so stretching, is the same. And again, we have workshops done on each of these modes of training that are very, very detailed in terms of exactly what you should do. And if you're interested in those, you can contact us or look back on our lecture series. Okay, so it's resistance training and predominantly aerobic exercise that you need to do for primary and secondary prevention of cardiovascular disease. Okay, so in terms of special exercise recommendations for cardiovascular disease, normally what I do is I take each condition, so angina, peripheral artery disease, whatever it is, and I'd have quite an extensive workshop on each. So in terms of the pathogenesis of the condition and the very specific exercise recommendations. In this case, we just want to point out some of the real practical recommendations that are applicable across the board and are very helpful if you have cardiovascular issues or indeed just want to look after your cardiovascular health. And the first is to meet the weekly recommendations for aerobic and resistance training that we've just mentioned. So 5 to 7 days a week for aerobic and 2 to 3 days for resistance training. And as always, particularly if you're not currently training, you start easy with low intensity and you build up slowly. And that's exactly what we've done with our Sláintecare participants over the last 12 weeks, who in fact we just have done post-testing on today, and the difference is absolutely phenomenal, and they're only training twice a week for the last 12 weeks. It's incredible. So start easy, low intensity, nice and easy, and build it up slowly. If you have cardiovascular disease, the priority is to keep working on your aerobic fitness until you can build up to 30 to 60 minutes of continuous exercise. So when you're starting out, you could be starting out on doing 1 minute of walking, and you'd need to rest then for a minute. Then you go again, and you could be doing 1 minute on, 1 minute off. Then you could be building it up to 2 minutes on, 1 minute off. It could be 5 minutes on, 1 minute off, and so on. Ultimately, you need to get yourself fit enough that you're getting up to that 60 minutes over time. And at that point, you have a very healthy, beautifully functioning cardiovascular system, which is obviously of crucial importance. If you have high blood pressure, moderate intensity exercise. Okay, so it's where you could talk to me if I was walking beside you. You're working, but it's not terribly strenuous. When you have finished your training session, that has a 24-hour lowering effect on blood pressure, which is fantastic news if you have high blood pressure. So you'll get this effect from both aerobic and resistance training, but you'll get a slightly greater effect from aerobic training. So daily exercise is very, very important for anyone who has high blood pressure. So if you have peripheral artery disease, angina, a recent cardiac diagnosis, and are poorly conditioned, then interval training is a really good option for you. And what I mean by that is actually what we do in our Sláintecare class. So we ask people to do an exercise for 45 seconds, and then they take a 15-second rest. And then we go again, another exercise for 45 seconds and take a 15-second rest. So you're working for 45 seconds, you're resting for 15. Now that was different at the start. It was working for 30 and resting for, 15 again. But over time, as the fitness levels builds up, you can increase the time you spend working and decrease the time you spend resting. That's called interval training. And another type of interval training is, particularly if your fitness level is poor at the start, if you do an aerobic exercise, for example, marching on the spot, okay, so you do that for 45 seconds and then you take a rest. If you follow that with a resistance training exercise, so for example, a bicep curl, lifting maybe a can of beans, and then once you've done your resistance training exercise, you go back to aerobic. That type of mixing up aerobic and resistance training lets you do a lot more work if you're poorly conditioned at the start. And again, we have circuits that we've sent to participants, and they're available if anyone is interested in them. They're free to access. But interval training can be a really good idea. for any of those conditions, plus if your fitness is poor at the moment. There are a lot of cardiac conditions I haven't mentioned in this presentation because it's impossible in a 15 to 20-minute lecture. Like, for example, heart failure. That has, and then there are different grades of heart failure. They have very specific exercise recommendations, and they would need one-to-one consideration. So what I'm really looking at now is just some of the basic things that we're seeing, like high blood pressure and so on, and how exercise can help those. The warm up and cool down is essential. We do a full 15-minute warm up with our participants. So we start slowly and we build up the intensity over 15 minutes. And it's during this time that you allow your heart rate and your blood pressure and everything to adjust from rest to exercise. And if you do that slowly, you'll have a really nice training session to follow with very, very low risk of an adverse event. Not the case if you skip your warm-up. If you skip your warm-up, it's very stressful on your cardiovascular system, and the likelihood of an adverse event increases, and it's all of that is negated with a simple warm-up. So warm-up and cool down as well, absolutely essential for cardiovascular diseases. And please take your medication as normal on days you're exercising. If you plan to exercise, whether it's an outdoor walk or whatever it is, and you just remembered you haven't taken your medication that's controlling your blood pressure or for whatever cardiovascular condition you have, you don't exercise. You go home, you take your blood pressure and your medication, and you exercise later. Because when you train, it puts pressure on your cardiovascular system, and if you haven't taken your medication, it may not be a good idea. So please take your medication as normal before you train. Okay, so hypotension is something that we need to talk about, and that is a drop in blood pressure, which can potentially result in fainting during and after exercise. And some of the medications that you take for different types of cardiovascular conditions can promote this issue if you don't take care of yourself appropriately in the class. So we need to mention it. And one of the simple things that you can do is to keep your feet moving between exercises. So, for example, our Sláintecare participants do an exercise for 45 seconds. And even though they're resting for 15 seconds before the next exercise, they keep wiggling their toes or just keep their feet moving very gently, because that keeps the blood from pooling in the legs and it returns it to the heart where it needs to go. And it's really good practice for training. So don't stand still between exercises. It can increase your risk of low blood pressure, so just keep your feet moving. Do not skip your cool down. Your cool down is the place where it allows your body to adjust from exercise to rest. So it slowly brings down your heart rate and your blood pressure and your increased blood flow and all of these things. And if you skip your cool down, that's a bit of a shock to a cardiovascular system, particularly if you have a cardiovascular condition. So please, please cool down and never skip your cool down. Also, take your time when transitioning between standing exercises and seated or lying exercises and vice versa. So it requires a significant blood pressure response to be able to do that. So to go from, we say, standing to lying and lying to standing. And if you have a certain cardiovascular condition and certain medications that you're taking, there may be a slightly delayed response with this. So you just need to take your time. And if you do that, everything will be fine. And also, don't hold your breath between exercises. Just keep breathing. So if you have angina, always have your GTN spray with you. Please attend your checkups regularly and tell your doctor what you're doing, because if you start losing a lot of weight, if that's an issue for you, and if you start getting really fit, and if you start improving your cholesterol profile and your glucose profile and your blood pressure and all these things, it may be a case that you may need to have a discussion about your medications. So just keep in contact with your GP and let them know what you're doing and let them follow your progress and see if any changes need to be made. Be very mindful of cold weather coming into this winter season. Blood vessels can constrict in the cold, which can be problematic if you already have narrowed blood vessels. So it can reduce blood flow, particularly in the coronary arteries, and cause chest pain. So what you just need to do is, well, A, you could train indoors using one of our home-based videos, but B, you'll just need a very good warm-up prior to exercise if it's particularly cold inside or outside, and just make sure that you do that, and it will help you not have any issues in this case. Healthy nutrition, of course, is absolutely crucial for a healthy heart, and our nutritionist Ruth will be doing that workshop with our Sláintecare participants next week. But it's beyond the scope of this short workshop here. stress management is also very, very, very important for good cardiovascular health and for people who have cardiovascular disease. Okay. And in summary, please try to do what you can to address the modifiable risk factors, and it will significantly reduce your risk of getting a cardiovascular issue or a secondary event if you already have one. So as always, we have provided our participants with numerous voiceover workshops, numerous home-based training videos for balance, flexibility, strength, cardiovascular exercise, and so on. And if you'd like to avail of those, you can just contact us and we'll be happy to send them to you. So you can contact myself, Diane, or John, our strength conditioning specialist. So on www.truefitness.ie or info@truefitness.ie, and we will be happy to send them to you. Okay, so finally, for anyone who's interested, so we are currently running a research study titled Prime Time for Middle-Aged and Older Adults, a strength and fitness program for adults aged 50 to 80 years in Laois. And we have recruited 80 participants. They're 50 to 80 years of age. Originally, we were supposed to run this on site, which we love to do, so we get to really know everyone, and there's obviously a lot of social interaction and so on. But of course, with COVID, and because of the age group of this group, and also all of the numerous clinical conditions and injuries and so on that exist, of course they're of the most vulnerable in society at the moment, so we had to change our study design to move to online intervention, which to be fair is probably going to be the future of training interventions for this population for the immediate future anyway. So it's actually a really good opportunity to trial this. So we have participants of all clinical conditions, all abilities, visual impairments, you name it, everybody is in this program. It's an inclusive program, and that's what it was always intended. There's very little exclusion criteria here. We received ethical approval for the study from DCU, so we were delighted with that. And we worked very hard for this to be an online intervention. Okay, so we conducted our pre-program tests at the start of September, and in the interest of time, we ran a battery of tests in small groups, of course, and with all precautions taken to assess strength, fitness, balance, flexibility for physical measurements. And then we did a number of questionnaires to look at mental health, quality of life, how active people are, and a range of other measures as well. And these, of course, were actually done on site because, of course, us as testers, we need to be able to assess these variables, but all precautions were taken in terms of COVID, and all procedures were approved by the DCU Ethics Committee. Okay, so from there we have moved on to our 12-week intervention, and so what the participants do is they train twice a week with us online. So they're all trained up on Zoom, and everyone is using that twice a week to train with us. Each training session is a combination of strength work, aerobic exercise, balance, and flexibility. Because what we're finding is, even for the people who are active, they mostly focus on aerobic exercise. But as we get older, we need all of the components of fitness. So we have all of them incorporated into each training session. So they do that twice a week with us, but they also do one mini workshop with us per week. And in those, we pick a particular topic and we take them through the science behind it in a very, very practical way. And we also support these with take-home resources in the form of handouts or videos or whatever it is that suits that particular workshop. And of course, we monitor everyone weekly. We constantly call people, email people, and we do as much as we can in terms of social support as well, because that's really, really important part of training. So we, at the end of each week, then we email everyone their participant take-home resources. So they're building up a big bank of physical activity and health resources that they can use moving forward. And the purpose of these mini workshops is to teach them everything they need to know that they'll be able to maintain these behaviours in the longer term. Okay. And of course, after week 12, we will be repeating the post-program tests. This is a research study, so we will be creating a research paper in January of 2021, and we're hoping to publish that in the Irish Medical Journal, so it'll be open access for anybody who's interested to take part. And obviously, this is important to say that we were commissioned by Laois Sports Partnership to do this particular research study, and it's funded by the Sláintecare Integration Fund under Grant Agreement 21.